again. As most of you know, I'm Dan from Montreal. You've probably heard of me before. If I haven't met you yet, the chances are I'm going to meet you by the end of the weekend, because normally I set myself an objective to say hi to at least every single person that comes to the event. So I'm going to get right into it, given I already presented before. All right, so Hacking Health is a grassroots organization that started back in 2012. We're a non-profit that's based in Montreal, although we extend to many countries around the world. The main objective of Hacking Health is to transform healthcare by pairing healthcare professionals with IT experts so that they can work on building solutions that are patient-centric to frontline problems in healthcare. So as I mentioned, we're in many countries around the world. Just last week we were in Brisbane, Australia, Cape Town, South Africa. 2 months ago I was in Milan, that's in Italy. We'll be going to New York, which will be our second event in the United States. We're all across Canada, I think in all 10 provinces. All that to say, I think we've touched approximately every single continent on the planet, which is a great success for us given that we've accomplished this in under 2 years. So, who are the people that make up Hacking Health? There's about 200 volunteer members strong that help organize these events on a regular basis. Apart from the active members, we also have many participants, probably in the thousands. We've placed these people into 5 categories, 5 buckets. As we see on top, we have the clinicians, the healthcare professionals, and let's not leave out also the administrators that work on the administrative side to help make these systems more efficient for us. We have the designers that help create the UI, the UX experience for us, create a seamless experience for the users of the applications. We have the entrepreneurs that create and implement business models right into the development stages of the app development. We have the developers that code away for hours to create a flawless app experience. And of course, we have the patients. In my view, these are the most important category that we have. At some point in our life, we ourselves will become patients, or at least support someone we know that is a patient. And so having these 5 stakeholders as part of the development process is key to this idea of collaboration. The output of collaborating between all stakeholders is tantamount to this idea of building a barn in a day. What you see here is an Amish community somewhere in the States that have mastered the ability to build a barn in 1 day. This isn't a joke. You can go on YouTube and watch videos of this. It's pretty remarkable. And so in the same way, what I'm trying to depict here is that by working together over a short span of time, probably under 54 hours, we can actually build MVPs, minimum viable products. In Strasbourg not too long ago, we presented 27 functional prototypes in just under 54 hours. This was remarkable for us because we hadn't achieved it yet. So it's really this idea of working together, sharing perspectives, working off each other's experiences, and working really rapidly to build something that we can test, A/B testing, user testing, right in the field, right on the spot. And so here we have patients that can see the apps. We have the healthcare professionals that are likely also going to use these apps. Let's speak to them during the weekend to see what they think of it, so that if it's not what they want or not something that they'll use, then we start back from scratch and we start over. And this is the idea of reiterating and iterating over and over again. So Hacking Health has this model of a funnel. I don't know if you in the back can see it, but there's a sort of funnel here, and on the top layer, you start with community building, which is obviously very important. If we didn't have a community, most of you wouldn't be here today. So we start with the hackathons, the cafes for networking, to get to know each other, to meet people that you would otherwise never meet. A healthcare professional probably hasn't met too many programmers in his life, nor designers, unless they were patients. And at that point, I'm not sure the designer wanted to talk about designing applications. If we go 1 layer down, we're talking about the creative phase. So here, we're holding clinics and consults, something that we hope Radboudumc will continue to hold after this hackathon event. And finally, we move to the build phase, where we implemented for the first time about a month ago in Montreal a Hacking Health accelerator. So we've actually closed the fund of about 1.5 million, And now we're working on building a process where graduating teams like yourselves after a weekend who decide to continue to work on a project can actually benefit from these funds. So just to run through some of the numbers, we've had over about 400 projects, well over 400 projects that have graduated from these weekends. And as you can see, the different categories together equate to over about 2,000 people that have attended these events.
Can you read the categories? Because I cannot read it.
Oh, so it's just 4 different categories. So healthcare professionals, designers, programmers, and entrepreneurs together, add up to over 2,000. And so before earlier I asked a question about stamped wearables. So just a few years ago, well, let me start that over. We've always been able to plug a computer into a car and obtain a diagnostic of the car's status at any given point. And now, ladies and gentlemen, for the first time in history, for less than the price of going out for supper in most cases, you can get your genome sequenced. You can also monitor continuously your vital signs, and you can finally open the blinds up to your health status. So, the objective of Hacking Health is to break down the barriers to innovation, to get out of this idea of working in silo. So after a weekend, we're not expecting anyone to build the greatest app known to man. Really the idea is to change the way we think, to change the vision, and to change the way we work, to work with different people. So over the weekend, again, I ask you, open up your minds to how you work with different people, ask many questions, defy the status quo, and to that, I wish you a great weekend, and thank you to the to Radboudumc University Medical Center for hosting this event in their location, and to Reshape, and to all of the great members of the organizing committee for hosting me, and Hacking Health for partnering with us, and let's hope to a great event. Thank you very much.